Hello viewers, thank you for joining me again on Health Pavilion. Today on Health Pavilion, we'll be discussing living with person with chronic disease. And with me in the studio is Reverend Father Anthony Efriye Amponsa. Father is a music therapist, a counseling psychologist, and a clinical psychologist. Father, you are welcome on Health Pavilion again.
Thank you.
How are you doing?
I'm doing well.
How was your journey?
Well, we can't complain.
We thank God. So, Father, is it necessary to know how to live with persons with chronic disease?
Why not? It is. It's so very important. You know, when people are pronounced to have certain diseases, naturally, they go through so much of psychological trauma. And so the announcement itself is traumatic. So if you get somebody who knows well about all these conditions and are able to live with the person's quality of life necessarily goes a bit higher. Yeah, so it's quite necessary, I should say.
So what are some of the examples of the chronic disease that we should be aware of?
Well, we can't exhaust all chronic diseases. We can't list all of them now on the show. But the basic ones that are quite common in our subworld, we have the HIV or HIV/AIDS, we have the diabetes, we have people with high blood pressure, we have people with some psychological or mental health challenges, which sometimes are a little bit on the sustained side, which we call chronic. Basically, we will say any disease that may not be cured necessarily, but can be managed is called a chronic disease. It means that the disease may stay with the individual for the rest of his or her life, but it could be managed. That is what we call a chronic disease as compared to other diseases that could be treated and discharged.
So how can this chronic disease affect the individual and the family?
Well, let's start from the individual. Right from the time that the person begins to feel ill health, all through to the possibility or the signals pointing to particular diseases, the person naturally become agitated, anxious. So you realize that these days I'm having constant headaches. I'm having, dizziness, drowsiness, and all this, and you don't know what is happening to you. Naturally, the person begins to entertain certain fears. Now you go to the hospital and you are asked to go and run certain tests, and the tests are so many, and the doctor tells you the reason why we are doing those tests, and they point to particular direction. Then it brings fear. Hey, what is going to happen to me? The person begins to think, okay, so once it is announced to you, it's like you are being hit by a bullet. So imagine an individual goes to the hospital, goes through all these long processes, and finally the doctor tells you you have diabetes and it can never be cured. How will you feel? So naturally, the person will go through a very first stage, we call it the denial stage. And during the denial stage, you are trying to tell yourself, no, it's not true. I mean, it cannot happen to me. Why me? Why me? So naturally, the person is in a depressed state, confused state, a state where he or she doesn't even know whether it is true or not. So then gradually, with a shock, then the manifestations will come. Then they will feel the bodily or the somatic effect. And gradually, they begin to feel a bit slower in what they used to do and they now cannot do. So that itself psychologically is very traumatizing. That is one aspect. Then the other aspect is, how do I then manage my finances? Because for all you know, you are paid, say, 1,000 cedis, 2,000 cedis, 3,000 cedis, and you are managing it. Now you are supposed to be spending so much money on medication, aside all the regular things you do. So financial-wise, you are hit again psychologically. Then when it comes to your relationships and how you live your life, so you are not supposed to eat this food, you are supposed to eat at this time.
Your favorite food.
Your favorite food, yes. You are not supposed to eat this, you are not supposed to do that. You can't hang out around this time, and as if you are being limited. That one too is traumatizing. Okay, then finally, how you feel, the physical pains that you go through, that self too is traumatizing. Okay, so at the end of the day, you have multifacets, you have different phases of trauma that only one person is going through at that time. Okay, so if it comes to the individual, it's so complex. That's it. Then when it comes to the family side, or the dependents and the acquaintance and the friends, then so it means that, okay, so now your wife or your husband or your children are thinking, okay, so daddy is going to, or mommy is going to face all this. Mommy is not able to be exciting with us. Mommy is not able to, or daddy is not able to do all this 1, 2, 3 things. And the money side, the support side is also going down. And if it's about friends, we are looking at, oh, this person used to come around and makes us happy. Now he's not able to come out again. And they become disturbed. That's the first side. The second side is when they get so confused, because then they themselves are not themselves. So you're expecting them to smile and they are not smiling back. Some of them, they are not even able to tell you the diagnosis. They keep it in themselves. So you as a dependent or a friend or a family member, you don't even know what they are going through and they are not telling you. So it will look like, why? Am I the cause? Why is the person doing this? So there's so much confusion everywhere. So that's how traumatic the whole thing is.
Can this disease cause anxiety to both the individual and their family as well?
Sure. You see, disease is disease. And every disease will reduce, of course, your quality of life and your lifespan. And so if you have any chronic disease, it means that it's going to stay with you for the rest of your life. So the first thing that comes to your mind is death. Am I going to die? So naturally, then you begin to be anxious. You are fearful. You don't even know what is going to happen. You don't know what happens tomorrow. Okay, so the anxiety sets in. And the anxiety sets in when it comes to, of course, all the facets of life I mentioned. How am I going to even manage my finances? How am I going to live my life? All these will create that level of anxiety, and naturally it becomes a problem.
To both the individual and the family as well.
Exactly.
So the consequences to affect both the individual and the family.
So in anything that we are going to talk about, it will affect the individual and it affects the family. It affects even friends, anyone around. It affects anyone.
So how would the family know when to come in during this stage? Like when the person is diagnosed of this chronic disease, how does the family come in?
The first stage of support, I should say support is what we need. That's all. You have to give the person support. But you cannot give support if you don't understand what they are going through. So if you have any family member, for instance, who have been diagnosed with a particular disease, you would have to just read around it or ask the doctors around it. So this particular disease, this cancer, this, high blood pressure, this diabetes, this and that, what is the meaning? What is the person going to go through? So when you understand, then you also understand them as well. Okay, so the first thing you have to know or you have to do is to gain knowledge. That's the first thing. You have to gain knowledge about it. Sometimes there are so many, secrets shrouding around it. We have other misconceptions around it. And so, so long as the person is cancerous, it means that the person, you can't even shake the person's hand and all that. You have to get all those misconceptions out. That is the knowledge part. The second part is for you to also help them to accept. As I said, when you are diagnosed, it's like a bullet. It hits you hard. You need somebody to help you to understand and say, I will be there. An assurance and acceptance. So, okay, so my husband or daddy, we hear that you have this disease or that disease. Don't worry, we are still your children. I am still your wife. I'm still your husband. It helps the person to now calm down. So one aspect of the anxiety goes down. So acceptance and assurance.
But sometimes it become very difficult for the person involved to even voice out what is actually happening to him or her when the diagnosis is mentioned.
Yes.
It's very difficult.
Exactly.
So to come out and tell another person, this is what I'm going through, you need to have courage.
Yes, you see, the unfortunate happens every day. But when it comes to other traumatic events, people are quick to talk about it. But when the armed robbers or the event happened to your body, you don't want, imagine somebody bumps into your room with a gun and takes all your property away. Will you say you will not tell your family? You will definitely tell. So if the armed robber called the chronic disease has entered your body and you have been informed, why don't you inform your spouse? Why don't you inform your family so that they are aware and they are able to support you? And sometimes the truth is, if you get the support, sometimes the quality of life is almost the same as it used to be. Okay. But without the support, that is where the problem comes in. So whether we have the courage or not, you may have to break the news. It helps.
You have to break the news, whether you have the courage or not. We'll go for a short commercial break. We'll be right back. Welcome back, viewers. If you are tuning in now, you are watching Health Pavilion and we are discussing living with person with chronic disease. And my guest in the studio is Reverend Father Anthony Efriye Amponsa. So Father, how can the family or individual cope with the situation with this chronic disease?
Well, there are so many ways with which you can help and cope with such a person, but I'll start with the don'ts. The first thing is, normally when you are diagnosed with a chronic disease, most of which are, of course, lifestyle, problems that bring those type of diseases. Okay, so already the person is feeling guilty. Imagine it's high blood pressure, where the person knew that when he or she was younger, could have exercised to avoid that. Or if it was diabetes, which the person could have managed the type of diet and all. If it's cancer, you just don't even know where it came from. You just don't understand how it happened, but it happened. So the first don't that a family could do in helping is not to send the person back to reflect what caused it. You see, I told you, if you are eating your food well, if you are stopping this food, it has already happened. So sending already the patient or the person in your family is feeling guilty. So if you send them back, it's a big problem. So you even worsen their condition. So the first don't is you make sure you don't send them back and making them feel guilty. The second don't is for you to let them feel that you are feeling the same way as they are feeling. Okay. So there's a difference between empathic expressions and sympathic expression. Sympathy is feeling the way the person is feeling and expressing the way the person is expressing. But empathy is feeling the way the person is feeling, but expressing it outside the way the person is expressing it.
So which one should we encourage?
Empathic. And so you may have to be empathic. So the person is crying, the person is sad. Let the person know that I'm equally sad, but I'm here to support you. I am not crying like you are crying. So if imagine the person is so sad and withdrawn, then you, the dependent or the family, you are also sad and withdrawn. Then all of us, yes. Imagine the person is sad and is crying. then you are also sad and is crying, and you are crying. Imagine the person is so angry, especially if the disease may have been caused by somebody like HIV, and the person is angry and revengeful. Then you are also angry and revengeful. Then you are being sympathetic.
Okay.
You have to be empathetic. You understand what the person is going through, but you don't express it the way the person is. It will naturally cool the person down. So these are the two don'ts. But when it comes to the do's, then you may want to give a reassurance that no matter what you are going through, we are there for you. As much as, and sometimes the reassurance go a little bit overboard. That is where the problem may be. So you let the person know that, oh, I'll be there for you. Is it that these days you can't walk and this, I'll be there for you. And the person calls you, be like, oh, today I'm running late, I'm at work. You have lied. And so you assure the person to what you can do, honestly.
To your level of,
to your level of support. Okay, so you let the person know that, oh, I'll be there for you anytime I close from work. I'll pass by for about 2 hours, daddy, before I go back home. Then you have been truthful. But if you're like, oh, I'll be there for you, I'll stop everything. So the first week you have stopped everything, you are there. And the following week you say that you have to go back to work. It hurts. So we have to be very honest about the level of support we can give. It includes even the monetary side. Okay. So looking at it, I can be able to be supporting you with at least your basic medication. That's where I can. So I also contact this person to see if the person can help with your feeding. Or I can also contact this person to also help with your transportation. So be very specific to things so that you don't end up disappointing. The reason is that they going through what they are going through because of one or two choices they made and they couldn't sustain it, that's backfired. So if you also give promises and you go back on your own words, then there's a problem. Another thing that you may want to look at, I know that it's not only Ghana that we have viewers, but we have most of our viewers may be Ghanaians or perhaps Africans. We are very religious, so you may want to support the person with prayer because it helps and reassuring the person with the person's faith. I'm not talking about only Christianity, but with the person's faith, and the faith will boost the person up. Okay, and the last one is for you to begin to give psychoeducation. I remember the first part when we were talking, I was like, you have to learn about the person's condition so that when the person says, all of a sudden, I can't do this, I'm so distressed, that you're able to tell the person that, okay, your condition, this and that is expected. So just calm down.
At this stage,
this will happen, this will happen. So you help the person to calm down. So these are the basic things that you can do. You may not be able to do much, but at least once you're able to do that and the doctors are doing this, then we are good to go.
Okay. So, Father, is it necessary for the person also involved to know what is actually happening to him or her?
Very well. As I said, psychoeducation is very important. Normally, it must begin from the hospital itself where the diagnosis was made. So I know most of the doctors will do it. Of course, in some hospitals where the number of patient to doctor ratio is so high, you may not get the time
to even educate your patient.
So sometimes I honestly don't blame the doctors. You know, the ratio is so high that you just have to declare the person, let the person
go into your own faith.
Yes, but as much as possible, I believe some of the doctors try. They are able to, sit the person down and explain. Sometimes you may not be able to explain everything on the go, but when a person is coming for review, you can keep educating the person on what is expected, what is about to happen, and all that, so that the person is prepared for it. Okay, and this aside, if the person is very compliant to medication, most of the chronic diseases, even including HIV, can really be managed well. Okay, and it helps. The last part of it that I want to put viewers' attention to is the fact that so long as you are tensed, the condition will not be getting better.
Okay.
Okay, so once you learn about it, you are expectant of certain conditions that may arise out of your condition. You are able to calm down, and the body itself will fight for you. But so long as the anxiety is there, I mean, everything goes haywire.
Father, do you mean to say the person should accept what is happening to him or her for the body to adjust, or what? Because it's not easy to accept certain conditions in life. So if you are telling us that the person has to adjust and accept for the body to work, it's not going to be easy.
Honestly, it's not going to be easy, but that is the best. The truth is, that is the best. So you accept the condition, then you know how to manage it. Imagine you don't want to accept that you have diabetes and you want to eat and have fun like everybody, then you are going to deteriorate. So once you accept that this is what I'm going through, you can manage to get things that will help you to reduce the effect of the condition on you. Okay, so acceptance is key. Even though at the beginnings of acceptance it's very difficult. Of course, sometimes there are conditions called the delirium that you could really go through, and sometimes you even lose your sense of orientation. You don't even know where you are. You talk anyhow. Sometimes there are even brief psychotic effects. You know, you become angry with yourself. You throw tantrums and everything. But at the end of the day, the thing has happened. Accept it, live with it, and it makes you better.
But some people also resort to prayers and foregoing medical treatment in their condition. Does it also help?
Honestly, it does. Prayer, whether Christian or Islamic or traditional, prayers are very, very important. It's a form of psychotherapy, honestly. Spirituality is very important. However, if you know what happens to the body, then you resort to both. Even in scripture, Jesus will heal you, cure you, and tell you, go and show yourself to the doctor. And in those times, the priests were the doctors. So you do both.
Okay.
You remember Jesus will cure people with hypoglycemia. I don't know if you know. People follow Jesus. People follow Jesus. They were hungry and they couldn't even walk.
Yeah.
Right? But yes, but Jesus will calm them down, pray for them, break the bread, give it to them, they eat, and now they can go. So Jesus has helped them spiritually and physically. Okay, so when it comes to when it comes to medication, it is very important. You don't go and sit in a prayer camp somewhere and expect Jesus to do everything. Jesus will do everything, but will use man to complete what he has started.
It's true. That's what most people do. When they get this pronouncement of chronic disease, the denial stage, they go to the prayer camps, do this prayer fasting, then the condition will be worsening.
Exactly.
Then they'll forgo the medical treatment. But right now, you've made us understand that you have to do both the physical and the spiritual. We'll go for a short commercial break. We'll be right back. Welcome back, viewers. If you are tuning in now, you are watching Health Pavilion, and our topic for today is living with persons with chronic disease. So, Father, when should they seek for help?
They seek for help when they realize, one, that what is expected of them in terms of the signs and symptoms of their condition is not what they are seeing or feeling as of that time. So, for instance, you've been told that so long as you are taking this medication and that medication, you'll be urinating so often or that, and you realize that it's not showing up as the doctor said, you quickly have to resort to for medical attention. Sometimes when we realize that the condition is deteriorating, you may want to also seek help, whether family or the individual themselves. You may have to, sometimes the individual himself or herself would have to prompt the people around that this is what I'm feeling. I don't, this is a little bit overboard what I expecting. So sometimes you realize that your condition is worsening. You may have to seek help. How do you know your conditioning is worsening? Physically, how do you feel? Are things going down on you and all? Once you're able to identify these, then you would have to seek help. For the family, sometimes the patient himself or herself may not be aware of what he or she is going through. But you from afar can see that you shook the person's hands to say, no, today you are a little bit too warm, or your body temperature is rising, or you realize that the person has suddenly slowed down, has lost weight, or has overly gained weight, the stomach is protruding, or something. You realize that something has changed drastically. You would have to seek help almost immediately. And these are the signs that you may have to be looking for and out for, and then seeking help.
Okay. So, Father, will the condition also cause stress for both the individual and the family as well?
Naturally, there are three main things that what every disease will cause. Abbreviation, we call it DAS. Okay, you are depressed, you are anxious, you are stressed. You are depressed, you are anxious, you are stressed. DAS, DAS. Okay, so naturally you are not happy. Nobody is happy being sick. So long as you have a chronic disease, you are not a happy person.
Not at all.
Okay, so it is just there. I mean, that's how you feel. Okay, so if you get support, it helps. Then anxiety, because you don't know what happens tomorrow morning. Okay, especially when it's getting to the terminal side of your chronic disease, where things have really gone so bad and it's obvious you're about dying. Of course, everybody will be anxious. And definitely when it comes to stress, everybody is stressed. You are stressed. You can't do the things you used to do. You can't have the fun you used to have. You couldn't do this and that and that and that. So you are stressed out. Financially, you are stressed out. You have been praying and praying and praying and no answers seem to be coming. You are stressed out. No miracle is happening. You are stressed out. When it comes to emotional wise, you easily burst out. You are stressed out. Everything.
Social aspect of the person's
Exactly. So the DAS runs through all. It's not just stress.
Okay.
Depression,
Anxiety,
anxiety,
and
stress.
stress. So how do they manage this stress, this DAS, if I should put it?
Normally, the amount of social support and emotional support that you get helps. But when it comes to scientific wise, when you come to our clinic, we have ways of measuring what we call a COPE inventory, a way of knowing what about you that helps you to manage certain conditions. There are some people, they do well with humor. You just make them smile or laugh, so they want to watch a movie that is funny, take their minds off, just go to take their family member out, or maybe to the mall or to a shop to take a walk. Humor helps. There are some people who resort well with religious coping, as we talked about earlier. There are some people who do well with emotional ventilation. Okay, they want to just pour out how they feel, and they get somebody to listen to them and they are fine.
So that's emotional ventilation.
Yes.
Okay.
There are some people who do well with positive social support. So once family members are around them, even if they have cancer, their wife or their husband and their children are always around them, they feel okay. There are some people who actively cope. There are some people who do well with substance. Substance could be anything. It could be food, it could be medication, it could be anything. Once you take something inside of you. So there are so many coping strategies. There are about 14 of them. Okay, so once we're able to measure out for you, you know which of them you cope better. Normally, when we measure, we give you about 4, so that means it doesn't become monotonous. So we give you about 4 of your own strengths. Then you rely on those strengths. So once the family and the person is able to identify your coping strategy, then you center on that, and that's how we manage. Apart from the pharmacological side, yes.
So, Father, with this, how can they make life better for both the person affected and the family and the people around?
Scripture says, for lack of knowledge, my people perish. That's all. You need to be aware of what you are going through and be aware of what the other party may also go through. So sometimes, for instance, for the individual who is not well, you are thinking, so if it was this other person that was not well and the person was treating me this way, will I be happy? So you put yourself in the person's shoes. What about the other people, the family members and friends? So if I was the one who was sick, will I be happy the way I'm being treated now? That's the basic thing, apart from the medicines and everything. The basic thing is understanding, knowledge, and applying the knowledge. You know, some people have the knowledge, but they may not do. They easily get stressed out. And the last one that you may want to consider is, we call something a burnout. Sometimes we are human beings. We get tired of certain people. You are managing this condition for all these years, and sometimes you realize that they don't even appreciate it any longer. You would have to sometimes know that you are getting burnout. You may want to walk out for a while and come back. Not see walk out of the person's life, but sometimes just get a fresh air, take a walk, you know, talk to somebody and get external help, get some inner strength and come back. And the quality of life will definitely go a little bit higher.
Thank you very much, Reverend Father Anthony Ifriye Amponsa. Father, I hope to see you again on this studio. God bless you.
God bless you too.
So viewers, you heard it all. I want to see you again same time next week on Health Pavilion with me, Mary Magdalene Amwakubuabeng. Bye-bye.